Good afternoon, Frederick. Welcome back to the Blaine Young Show, talking with Dr. Vitarello, Chief Cardiologist at Frederick Memorial Hospital, about the healthcare proposal and reform. Let's go to, he's been holding the longest, James. James, welcome to the program.
Good afternoon, Blaine and Dr. Vitarello.
Good morning.
How you doing?
What's up, sir?
Just have an observation and a question. Normally, when if you're in a fight with a gorilla, you accept any hands that you can get. But I've been wondering, it appears to me if this health plan goes through and basically is the demise of the private insurers, that the trial attorneys would be concerned about that because that's been their cash cow for years. And I'm just wondering, have they weighed in on this? I mean, they're have a lot of very strong lobby in our government, and where do they come down on that?
Yeah, this is easy. This is a real straightforward question. If you have the public option, that's what they want. For instance, the public option, you can still sue a physician, and the physicians, we still get we get sued the same amount, by the way. And guess what? We'll probably get sued more because let's say you're 20 pounds, 30 pounds overweight, and you come in with a heart attack, and the guidelines say you can't have one because you're a smoker and overweight. And you turn around and you say, I'm not that overweight. And the jury says, well, he's not that overweight. They sue me. And if they start cutting back services for you and I use a cheaper cholesterol-lowering drug and you have a heart attack because it's the yellow pill, not the red pill, and I follow that nonsense theory of giving the cheaper pill which doesn't work, you can sue me. So there is no protection for the hospitals and the doctors when they get sued with the new health care. There's not one sentence in that for tort reform. So that's not good. And what it's done is it's really driven a lot of the doctors out of our state. I used to do pacemakers here, right? I get maybe $4,000, maybe $3,000 a year to do pacemakers. They increased my insurance to $30,000 a year just to do pacemakers. It's crazy. What they're doing is taking good docs who trained 17 years. We can't do our job because we can't afford the malpractice. So the health care bill does not protect the patient, but the public option doesn't protect the patient. And all it does is allows the malpractice lawyers to continue suing doctors, frivolous lawsuits, at the tune of $30 billion a year, 1.5%. And that doesn't even include, by the way, the hidden costs of the tests we do to defend ourselves. I appreciate that question.
Let's go to Craig. Craig, welcome to the program.
Hi.
How you doing?
Good. My mouth's a little bit full. I was eating a salad here, and I wanted to ask the doctor. He made the comment in the first hour that some people are just built that way with regards to people that are overweight. I'd like to know the percentage of people that are overweight that aren't that way because they have a thyroid problem or whatever. They're that way because they eat too many calories.
Right. That's a very good question. I would say in my clinical experience as a doctor, about 30 years actually, I would say about 30% of the patients, 30 to 35% of the patients have a genetic predisposition to being overweight. The rest of our society overeats, eats the wrong foods, and does not exercise enough. So I would say maybe at 60% contribution from what we do wrong. All right. Now, the American culture is designed for that. If you go to a restaurant here, in, let's say in the United States for Chinese food, the plate is about 12 inches long. If you went to Paris, we did a study, it's about 6 inches long. So it's a cultural thing. Now, the question is, are fat people being discriminated against here? Are they the victims of this new health bill? Listen to some of the blogs out there. Look at some of the literature. What they're saying is they want to tax, check this out, tax people overweight. They want to charge more money for their insurance and deny them health care if they need a hip replacement or a bypass or an angioplasty. Yeah, I know it's, as a cardiologist, I believe it's important to keep an ideal body weight, but only probably about 30% of us can do that. But for the rest of the people, we need to work with them, give them preventive medicine, better education about diet, cut back the sodas, increase the exercise, but don't punish the person who's overweight, but denying them a life-saving procedure. That's cruel.
Well, I guess that's my point would be that what can we do to fix this problem? Okay, so one of the things we could do is engineer it so that people don't need as much health care. And if there's something that comes down to a personal choice where people are going out there and choosing to consume too many calories during a day and choosing not to exercise, then maybe the system should be structured in such a way that they pay more money for their health insurance. They are making these decisions after all.
Right. The question is, how do you decide, who's overeating? Like an example. I had a lady today who was a widow and came in. She lost her husband in a car accident. And she's been eating. She says, she's just stressed out. I'm trying to work with her not to eat as much because it's comfort food, right? The question to you is this. You have to work with the patient intimately to make them lose weight and continue to be their cheerleader and give them good information. Do you make them pay more for their health insurance? Probably not, because I would consider that as a disease, and you put that in a pool with everyone else. Remember, if you insure these other 39 million people who are college students, all right, they're not overweight. They're going to actually bring down the cost of your health insurance. So, and another thing, a question to you is, maybe you should put a tax on soda. That's probably the leading cause, sucrose, the leading cause of obesity in young people. Why don't you tax Cokes, all right, and root beers and all that nonsense, or beer. People drink excessive beer and add calories. Maybe that's a way to raise some extra money, but don't punish people because they're obese. And I think that's tough. And I think a lot of them try, have you ever seen a dog that's 10 years old? The body habit is the same at age 10. You don't change it. It's very difficult to change, sir. Mammals don't change their body size in midlife unless they have tuberculosis, cancer, or AIDS. So you pretty much get stuck with your body if you don't do it. What we need to do now is focus on the young generation. Look at the kids in elementary, middle school, and look at the diets they're eating in our school systems that are full of fat, horrible diets. Focus on them for the next generation. That's where you're going to see your cost dollars saved.
All right, Craig, thanks for the call.
Yeah, and I'd like to hear more about this, Blaine, because I think you need to educate people as to how they can take better care of themselves. A lot of people don't know what to eat and what not to eat.
They just got to make the healthy stuff taste good. It'd be easy.
Now, I'll take the challenge. You invite me over here, and I'll tell you some great ways to lose weight and healthy diets. And Blaine will have me back. We'll talk about maybe a healthy lifestyle. Maybe we should be talking about the good things we can do.
All right, Nikki, welcome to the program. Nikki, are you there?
Yes, I am. Sorry, Blaine, I didn't hear you.
No problem.
I just wanted to offer some information about the gentleman that called in about TRICARE.
Okay.
I was able to look online because that question's been on my mind, what was going on with it. And at military.com yesterday, I did find an article in there on TRICARE. And this is what this article said, that apparently when they wrote the bill, HR 3200, they inadvertently did not exclude TRICARE, but that they are introducing an amendment. I don't know if it's a congressman or a senator, Joe Wilson, I think is his name, and to an amendment to pull that back out and not have it be part of the health care reform.
Now, can I tell you something? That's an interesting point. But you know what's going to happen, though, ma'am? This is what's going to happen. When they offer a public health option with the government controlling it, check this out. What's Walmart going to do? Walmart. I'll guarantee what they're going to do. They're going to go with the cheapest thing out there and just get it. Mm-hmm. Will the Department of Defense do that? Maybe they would.
Well, we talked about off air that one of the ways to solve this problem is buying power.
Exactly.
And the president has to have a set of cojones to have that, to say, look, this is what we have, and go to the places where there needs to be true reform with the buying power.
That's exactly right. I agree with you, Blaine. I mean, right now, just think about this, ma'am. The federal government, they have Blue Cross Blue Shield Federal. That's probably the best insurance out there. It costs me $14,000 or $12,000. All right, my brother works for the federal government. Same plan pays $8,000. Same plan. What they do is the government buys in mass. And there's like 1,200 companies in our country that offer health insurance. In the District of Columbia, there's about 120 of them that participate with the federal government. Here's what you should do, that the government should do, is they should go out and say, listen, we will offer the same health care plan that President Obama has and Congressman Bartlett has. Mm-hmm. The Supreme Court has. Instead of us paying this money, we're going to get you a reduced fee because we're going to buy it in bulk. And we're going to take all these people with pre-existing illnesses and spread it equally based on the size of the company. Now, here's another good point. You know, to administer a health care program takes 31%. So let's say it's $1 trillion and you want to have a public health care. That means you have to spend $300 billion right now just to administer it. Why do we want to do that for? You already have these other insurance companies out there that have administrative capabilities. Let them put in the effort and the money to do that. They're making plenty of money on us as it is right now. Why should the federal government create $300 billion worth of bureaucrats trying to do this and run it where they're having a hard time running Medicare as it is, let the private insurance companies do what they do best,